Hi everyone, Professor Jenny McDonald here again, continuing to shine the light on the condition called lipedema. Now in this video I want to touch on diagnosis because unfortunately there is no one test, no one tissue sample that will get you a diagnosis of lipedema. And that the reason for that is it doesn't exist. So getting a diagnosis for lipedema is a collection of symptoms and characteristics. So to build that picture, clinicians will look at the symptoms you're having, when they started, the severity of them, what makes them worse, what makes them better. They'll also explore your family history of lipedema, your medical history that could give us clues, the medications that you're on, and exploring in a little bit more depth around hormonal times in your life. So that could be puberty, menopause, pregnancy, for example. And then a little bit more depth into any hormonal medications that you're taking. And it might be something like the contraceptive pill or HRT for menopause. So that's kind of like the symptom building and the history. And then we move on to measurements. Now, we know body mass index, the BMI, is absolutely useless for people with lipedema. And that's why we take full body measurements. Now, it's nothing fancy, it's just a measuring tape. But what we do is we measure the hips, the waist, and any affected and unaffected limbs, so arms and legs. And a classic symptom of lipedema is when you put all these measurements together, it has an abnormal measurement ratio. So that helps us, again, further build the picture to whether someone has lipedema or not. The next thing that we do is a full skin check. So we're looking at normal skin, we're looking at potentially lipedema skin. And what we're looking for is the texture of the skin. Remember I said in a previous video, it can sometimes feel like rice under the skin or nodules. So we're looking for the texture, we're looking for the nodules, and we're looking for unexplained bruising as well. And those three things together kind of build that picture towards a lipedema diagnosis. Now at Pioneer, we know a lipedema diagnosis is really, really important to people. And that's for many reasons. When people get a diagnosis of lipedema, it's really overwhelming. But patients also tell us it's a relief. They it's the not knowing that causes anxiety and stress. So when they have that diagnosis, yes, they're going to have to make life adjustments, and we can help with that. But it's the knowing that is important to them. And on the other side, people who come to us and don't get a lipedema diagnosis, they also tell us they feel relief because at least they've kind of ruled that condition out in their exploration to try and get to the bottom of their symptoms. Now, at Pioneer, our motto is hope, and we want to give patients hope, and that's what we're here for. But in the next video, I'm going to touch on exactly what happens when you come to a Pioneer clinic to get that diagnosis. Now, if you have any more questions, please write them below or jump over to our website at pioneerprivatecare.co.uk. Bye.